The leprosy diagnosis is mostly based on clinical evaluation and diagnosis. But in many places, especially here in Mozambique and other places, the knowledge and the skills to diagnose leprosy is not everywhere available. So we train healthcare workers from time to time, but if they are not exposed to it often, or if you have changes in personnel, you have to start from scratch again. So the diagnosis of leprosy, the bottleneck there is the clinical aspect of it, that you need somebody with clinical skills to make the diagnosis. So this results in many people coming to clinics with signs and symptoms of leprosy, but the staff are not able to diagnose leprosy, or they think it's something else, and people are missed and come only when complications are already visible. So we are looking for a tool that could help those healthcare workers when they are in doubt or in evaluating skin lesions, to give them already an indication that this might be leprosy, and in that way help people affected by leprosy get better access to correct diagnosis and treatment. For them to have access to a good diagnosis, sometimes it's a long process to find somebody that's able to make the diagnosis correctly. So we hope that this tool will make the road a bit shorter for them, so that this could help a healthcare worker get to a correct diagnosis quicker, and in that way that people affected by leprosy can have access to good treatment in time before complications develop. That's what we hope will come from this. So our first step would be to find out if there are spectral bands that would be typical for leprosy and for leprosy skin lesions. We know that leprosy lesions have a great variety of ways that they can present, so we do not know exactly what we will find. So our first step is to try and study those skin lesions with spectral imaging, to try and find if there are spectral bandwidths that are more typical to leprosy skin lesions. If we do find those, then we will hope to equip either a cell phone camera or some handheld device that would already have that knowledge programmed in, that people can use by placing it on a skin lesion, doing a scan, analyzing the data, and then giving a result which could either be a scoring, say, okay, this is 80% chance that this is leprosy, or it might be even that with time you increase the databases of available spectral data for other skin diseases, and it would say, well, probably this is this type of lesion, or it is leprosy, or it is some other skin lesion. So it will be a tool in the hands of healthcare workers to then be able to evaluate skin lesions and not to miss maybe a diagnosis that is not very common.